The history of tuberculosis bacillus, or better known as TB. Mycobacterium tuberculosis complex. Let's talk about the origins of TB. It started in Africa and then migrated into Egypt. In Egypt, TB was extracted from the remains of pharaohs.
Some more history on tuberculosis. Little is known for sure, but here is some more information. In 1679, there was the first determination of tuberculosis' effect on humans. It was found that tuberculosis took effect in the lungs, where pathogenesis occurred. From historical documents, we know that tuberculosis spread. It was first documented in Europe, and was then said to have spread to North America, where you see a farmer here. This took place between the 18th century and the 19th century. In 1865, the first tests were made to determine the effect of tuberculosis, and if in fact it was the bacteria causing death. And indeed, when they injected a bunny specimen with tuberculosis, over time, the bunny ended up dying, unfortunately. Goodbye, bunny. In 1889, the first identification of the bacteria was made as Tuberculosis bacillus. Knowledge is indeed power. Next, the initial tests in 1907 were made to see if tuberculosis was in an individual. Here we see Mr. Clemens. And in fact, Mr. Clemens did indeed have TB identified by a large bump after the infection. Tuberculosis can be transmitted in the following way. An individual, let's say Sam, can cough on another individual, let's say Martha. Martha could then contract tuberculosis from the saliva in Sam's cough. Poor Martha, goodbye. In another situation, Martha could in fact have latency of the bacteria in her system. This would take the form of Martha having the bacteria live inside of her body with no symptoms. However, it would then reactivate at an undetermined time and cause Martha to die.
Now let's look at the history of tuberculosis cases over time. As you can see by this graph, which illustrates the number of cases per year, we can see that the number of cases decreased from the year 1906 up to the year 2014. The reason for the decrease in the incidence of this bacteria is because of early diagnosis, vaccination to prevent, and medication as treatment.
The conclusion to this estimated history of tuberculosis would be to get tested and stay aware of your surroundings. A goodbye.
Alright, Craig, I'm going to administer your TB test now. Do you understand how it works?
No, I don't. Could you explain it to me a little?
Yeah, so what we do is we take a small amount of inoculated TB and we inject it into your forearm.
That sounds a little dangerous.
Well, I know you might have some concerns.
Used in the vaccine is non-pathogenic because it infects cows, not humans.
For a reaction with your skin over a period of time.
That doesn't sound too bad.
Yeah, so are you ready to get started?
Yeah, let's get it done with.
After 48 to 72 hours from injection, the test is read. To read the test, a doctor will examine the injection site. Basis of the reading is the presence or absence of an induration, which refers to the raised, thickened local area of the skin reaction. This bump is usually red. The redness around the area is not measured, only the induration. Levels of risk for abnormal result are a firm bump that is 5 millimeters in size indicates people who are in high risk. A firm bump that is 10 millimeters indicates people who are at moderate risk. And a firm bump that is 15 millimeters indicates people who are low risk. A negative test shows no firm bump at the test site or is smaller than 5 millimeters. A negative test does not always mean that a person is free of TB and should be confirmed with a chest x-ray. People who have a positive TB skin test with a normal chest x-ray are not contagious, but may need medicine to prevent them from ever getting active TB.
These are some of the antibiotics that are used for TB. The first one is called isoniazid or INH. This is the most commonly prescribed antibiotics for latent TB. However, this can cause liver damage with long-term use. Another one is called rifampin or RIF. This is also prescribed for latent TB, but there is some side effects. Side effects can reduce the effectiveness of some types of contraception. It works for bacterial infections, not viral. The next one is called ethambutol. This helps stop growth of bacteria, only works for bacterial infections, not viral. Side effects are headaches, upset stomach, numbness of hands and feet. Rare but serious side effects. Mental, mood disorders, sign of new infections.
Treatment for TB. The first line of defense is constituted of antibiotics: ethambutol, pyrazinamide, rifampin, isoniazid. If TB is resistant to these antibiotics, then it's classified as MDR-TB, which stands for multi-drug resistant tuberculosis. If you have MDR tuberculosis, then you're given second-line antibiotics, which are fluoroquinolone and other injected antibiotics. If you're resistant to the first and second line of defense or antibiotics, then you have XDR or extremely resistant tuberculosis.